Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Cryptosporidiosis. Introduction. Cryptosporidiosis, also known as crypto, is an illness caused by a parasite. The parasite lives in soil, food, and water. You can become infected if you swallow the parasite. The most common symptom of crypto is watery diarrhea. Most people with crypto get better with no treatment. However, crypto can cause serious problems in people with weak immune systems, such as people with HIV or AIDS. This program explains what cryptosporidiosis is and what causes it. It also explains how the illness is diagnosed and treated. Cryptosporidiosis. Cryptosporidiosis is an illness caused by a parasite called Cryptosporidium. Both the disease and the parasite that causes it are commonly known as crypto. A parasite is an animal or plant that gets nutrients by living on or in an organism of another species. Cryptosporidium is too small to be seen without a microscope. The parasite that causes crypto lives in the intestines of infected people and animals. This causes symptoms related to the stomach and intestines, such as diarrhea or vomiting. Symptoms. Symptoms of crypto usually appear 2 to 7 days after being infected with the parasite. Some people with crypto may have no symptoms. The most common symptom of crypto is watery diarrhea. Other symptoms can include dehydration, fever, nausea, stomach cramps or pain, vomiting, weight loss. Symptoms can last up to 2 weeks. In some cases, symptoms come and go for up to a month, even in people with healthy immune systems.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. The cryptoparasite settles into the intestine of infected humans or animals and reproduces. Cryptoparasites spread to the stool of infected people and animals. Cryptoparasites start infecting the stool when the symptoms begin and can continue to do so for weeks after the symptoms stop. You can develop crypto by swallowing the parasite that causes the illness. The parasite may be swallowed by eating contaminated food or water. Crypto cannot be spread by blood. The parasite can also be found in soil or on surfaces that have been contaminated with the feces from infected humans or animals. Food or water that comes into contact with these surfaces can become contaminated. It is also possible to become infected if you touch contaminated surfaces and do not wash your hands. The parasite can then get into your mouth from your hands by eating or touching your mouth. Some other common ways people accidentally ingest and become infected with crypto are swallowing recreational water contaminated with crypto, eating uncooked food contaminated with crypto, oral exposure to human feces through sexual contact. Diagnosis. Before diagnosing crypto, your healthcare provider may begin by asking you about your medical history. This could include questions about your recent diet, travel, and activities. This can help your healthcare provider determine if you are at risk for a crypto infection. A physical examination will then be done. To diagnose crypto, the following tests are often used. Acid staining test. Stool culture. For an acid staining test, a healthcare provider may ask for a stool sample. Rarely, he or she may take a tissue sample from your small intestine. The sample is then viewed under a microscope to look for cryptoparasites. For a stool culture, a sample of feces is collected and then bacteria that may be in it are allowed to grow in a laboratory. Stool cultures help diagnose a bacterial infection of the digestive tract. It cannot detect the presence of crypto, but it can help rule out bacterial infections. Testing for crypto can be difficult. You may be asked to submit several stool specimens over several days. If your healthcare provider finds crypto, more testing may be needed to check for possible serious complications. For example, checking the function of the liver or gallbladder may help determine whether the infection has spread. Patients with AIDS may need a blood test called a T-cell count to help predict how long crypto will cause symptoms. A high T-cell count suggests a quicker recovery. A low count may require the patient to be monitored for further complications. Complications. Complications of Cryptosporidium infection include inflammation of a bile duct, the passage between your liver, gallbladder, and small intestine, inflammation of your gallbladder, liver, or pancreas, malnutrition, which results from poor absorption of nutrients from the intestinal tract, severe dehydration, significant weight loss. A crypto infection isn't life-threatening for most people, but for transplant patients or people with weakened immune systems, the development of complications can be dangerous. Treatment. Most people who have healthy immune systems will recover without treatment. Diarrhea can be managed by drinking plenty of fluids to prevent dehydration. Young children and pregnant women may be more at risk for dehydration. Rapid loss of fluids from diarrhea may be especially life-threatening to babies. For this reason, parents should talk to their healthcare provider about fluid replacement therapy options for infants. Anti-diarrheal medicine may help slow down diarrhea, but you should consult a healthcare provider before giving it to your child. Your doctor may prescribe some medications to treat the diarrhea caused by crypto. Talk to your healthcare provider for more information. People who are in poor health or who have weakened immune systems are at higher risk for severe and more prolonged illness. Patients with HIV who suspect they have crypto should contact their healthcare provider. For persons with AIDS, antiretroviral therapy that improves immune status will also decrease or eliminate symptoms of crypto. However, even if symptoms disappear, cryptosporidiosis is often not curable. The symptoms may return if the immune status worsens. Prevention. The best way to prevent crypto is by practicing good hygiene. This section reviews some general tips for avoiding infection with cryptosporidiosis. Wash your hands after changing diapers or cleaning up a child who has used the toilet, after handling an animal or animal waste, after using the toilet, before and after tending to someone who is ill with diarrhea, before preparing or eating food. The best way to kill infection-causing agents such as parasites is to wash your hands with soap and water for at least 20 seconds. Rub your hands together vigorously, scrubbing all surfaces. If you work in a child care facility, exclude children with diarrhea from the child care settings until the diarrhea has stopped. This reduces the risk of spreading the disease. When visiting a pool, lake, or other recreational body of water, protect others by not swimming if you are experiencing diarrhea. If you have been diagnosed with cryptosporidiosis, do not swim for at least 2 weeks after diarrhea stops. If you can swim, change diapers in the bathroom, not at the poolside. Shower before entering the water. Take children on frequent bathroom breaks and check their diapers often. Wash children thoroughly with soap and water after they use the toilet or their diapers are changed and before they enter the water. When working around animals, you can prevent crypto infection by minimizing contact with the feces of all animals, particularly young animals, washing hands after any contact with animals or their living areas, wearing disposable gloves when cleaning up animal feces, and always washing hands when finished. If you work outdoors, you can also prevent crypto by washing your hands even if you wore gloves. This is very important for gardeners since crypto may live in soil. People with weakened immune systems should do the following to avoid crypto infection. Avoid close contact with any person or animal that has crypto. Not handle animal feces.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cryptosporidiosis, also known as crypto, is an illness caused by a parasite that lives in soil, food, and water. It may also be on surfaces that have been contaminated with waste. You can become infected if you swallow the parasite. The most common symptom of crypto is watery diarrhea. Other symptoms include dehydration, weight loss, stomach cramps or pain, fever, nausea, and vomiting. To diagnose crypto, your healthcare provider may require an acid staining test or stool culture. These tests may require a stool sample. Testing for crypto can be difficult. You may be asked to submit several stool specimens over several days. An infection by Cryptosporidium isn't life-threatening for most people, but for transplant patients or people with weakened immune systems, it can be dangerous. The best way to prevent crypto is by practicing good hygiene. Hand washing and carefully cleaning surfaces where food is served are good ways to prevent an infection. You should also avoid swallowing water when using public water areas.
Thank you for using Explain.